Hello, I'm Dave Jacobs. I'm the first deputy director of the National Center. Well, back then it was called the National Center for Lead-Safe Housing in the early 90s, and it later became the National Center for Healthy Housing. I think the center's main contributions over the years of its existence has been to eliminate several gaps and voids. The first is between housing and health. In general, I think that we've made enormous progress in helping people grasp the important relationships between those two fields, although, of course, we still have more work to do. Secondly, I think we also created, we helped to end a void between science and policy in this field. We were able to bridge those divides by making sure that many of our policies were based on the evidence. And then perhaps most importantly, we helped to end the gap that existed between parents and communities and scientists and advocates so that we could collectively argue for the necessary resources to conquer the problem by acting on the evidence that we had of what worked and also what did not work. So ultimately, all those, our ability to help fill those gaps helped to end the sense of hopelessness that had gripped the nation for decades before the 90s. And in fact, it created a sense that, yes, in fact, if we act on what we know, if we act on the science and the evidence, and if we create the necessary political will, we can, in fact, conquer the problems that still afflict far too many children, but for which we had made enormous progress. So out of all that emerged standards, and those standards governed how the work would proceed and how it would basically be carried out so that it protected children. It ended the earlier sort of abstract legalistic debates that were only successful in doing finger pointing and needless litigation and didn't really help guide people who wanted to protect children in doing it the proper way. Some of those earlier attempts to control lead and other housing hazards were perhaps well-intentioned, but they ended up doing more harm than good. And in all too many cases, children ended up back in the hospital instead of being protected. So the ability to create the science and characterize the uncertainty, of course, that exists in all knowledge, did two things. It enabled us to create the standards and to help implement them broadly. Those standards came out of many studies that we've done. We have, for example, done the nation's largest study ever, which still remains a definitive study in this field of lead hazard control of how to mitigate the problems. This was carried out in 14 jurisdictions in over 3,000 housing units across the country. So that study really was able to set later government policy and also private sector practices to make important progress. Now, of course, one of the other things the center did was to help build an important coalition so that we could explain to our decision makers the importance of acting and investing the necessary resources to make sure that the work was completed, and that, after all, it doesn't make sense to just create knowledge if there's not going to be any ability to implement what we have learned to protect children. Now, the center also attracted many gifted and talented individuals over a long period of time from all walks of life. I'm pleased to have gotten to know many of them and count them as among my dearest friends and colleagues. And I'm sure, and we also had some fun along the way, which is also an important ingredient in any organization's life. I'm perhaps most proud of the fact that the evidence shows that the policies that we championed and the science that we helped create did in fact work. It protected, blood lead levels have come down over 93%. We obviously still have more work to do in this vein, but I think that the fact is we have created the foundation upon which that future work can be built, so that the day will come when our houses and homes support the health of children and enable them to grow up to be the best and the brightest they can be. So good luck to the center in the years to come, and I wish you the best.